Okay, good morning, section M to M. Magandang umaga.
Good morning, ma'am.
Okay. Sige, we will not start not unless I can see all of you opening your cameras right now. I can only see Miss Amigleo. Automatic na. So no need to remind. It's going on midterms finals na tayo. Your cameras na. Do not wait for somebody to remind or your teacher to remind you. Okay, so we are in this virtual classroom. All right, so shall we start? May I request Mr. Ang to lead us in prayer?
Let's put ourselves in the Speak in the harbor of your safety. I pray that you grant us wisdom, knowledge, and understanding. Increase our capacity, Lord, as we learn. We ask you to strengthen us, restore us. Lord, will you fill us with your for all to your love and grace to others? We ask this in Jesus' name, amen. In the name of the Father, and the Son, and the Holy Spirit, amen.
Okay. Kailang ba, Mr. Ocampo? Hindi ba ako napuputol on your end? Dungog ba kaayo akong tingog? Napuputol ako?
Konti, ma'am, pero
Miss Asturias, okay lang ang dating ko?
Nagaputol-putol rin po.
Okay. Sige. Miss Rial, on your end?
Medyo chubby sa ma'am.
Sige. So kindly inform me ha pag medyo hindi na ako naiintindihan so that I would also be aware. All right. Sige, today is October 19, so it's Wednesday, so it's class day for NCM 206, no, sa section M. How are you? How was your RLE? School nursing kayo, just like the other section?
delivery po, ma'am.
Okay.
Delivery po.
So you were already exposed in the hospital right now, no?
Opo, ma'am.
Okay. So very good, no? Saan kayo nag-duty? Ang section M?
SPH po.
Lahat?
Ay, ano po, ma'am? Hindi po, ma'am. Ang iba sa Paris lying in.
Merong nag-out of town? Wala. Wala.
Wala pa,
So
ma'am.
dito lang
Sa
sa
Paris.
dito lang sa Davao City. Okay, sige. So it's basically a week before your midterm. So midterms na natin next week. Okay, so your examination is already submitted, no, sa nursing council, no, for printing. So for today, I am just going to have a run through on the lessons that I have posted on Twitter, vascular medications, along with the drugs in relation to blood coagulation and the diuretics, no, in relation also in the management of hypertension and edema. And ano pa ba yung repost ko? And I will have an additional lesson to tackle for today, all about antiviral, no? So those are included, no? All of those topics, no, that we have started over midterm will be included sa examination, no? So basically, nagsugod ta on our discussion with the remaining antibiotics, no? We started out with tetracyclines, no, up to the unclassified peptide, no, na antibiotic. Okay, then the antihypertensive medications part 1 and part 2. Then included ang cardiovascular medication, blood coagulation meds, as well as diuretics and the antiviral. Okay? So the examinations is basically not identification of the name, but it's basically more on your nursing management. What will you do in cases na inom si patient ng ganito? So what would be your primary or priority management? Okay? So especially with antiviral, basig ma-overwhelmed mo sa mga names no, of the medications, it's just very important to just know kung para saan yung gamot, no? Especially with the classification. Kasi with the naming, no, so we cannot really memorize it in just one click of a second, no? Yung mga pangalan ng mga antibiotics. Okay, so nakapag-adi na ba kayo with the cardiovascular medications? Meron bang natutunan doon, Ms. Carnahe? Advance ko binibigay yon para by the time na mag-lesson na takaroon, gamay na lang inyong sabton. Anong natutunan sa lesson ng cardiovascular medications like the cardiac glycosides as well as the anti-anginal medication? Anyone from the group who would like to share your knowledge? You can also use the chat box for your comments or questions. Kasi anti-hypertensive medications would basically go along with cardiovascular drugs, no? Especially pag meron ng complications sa heart ang pasyente. Okay? Meron ba? Or wala na po'y naminaw ato akong lesson. Useless lang day kaayo to.
Ma'am.
Yes,
So,
Lauren.
sa ma'am, dito sa cardiac glycosides and anti-angina basically ito yung mga parang medications that we usually prescribe sa mga people that have first ma'am sa congestive heart failure, which is the endpoint of mga all cardiovascular diseases such as yung mga hypertension, yung CAG, cardiomyopathy, and here comes the medication refers yung cardiac glycosides, ma'am, which specifically may kang example dun, ma'am, which is yung digoxin, tama po ba? Digoxin. And yung mode of action niya specifies na gina-inhibit niya yung sodium potassium pump that really increases the calcium sa intercellular. At the same time, ginapapasok din yung calcium, ma'am, para it can cause depolarization, which yung mga inotropic action, chronotropic action, and dromotropic action. And basta ang endpoint niya is it really increases the cardiac output, ma'am, and yung perfusion. Renal perfusion.
Very good.
And pag abot naman sa ma'am, although meron siyang mga ma'am, yung parang toxicity, which we really need to parang prepare din yung antidote niya, ma'am, which is yung digoxin, immune feb,
Immune
which
fab.
Sorry ma'am, immune fab, para in case na magkaroon ng intoxication. Kasi di ba, ma'am, ang niya is dapat mga 0.5 to 2 nanogram ba yung nanogram per ml.
Yes.
And if magsobra siya 10 nanogram per ml, ma'am, kay toxicity na siya, ma'am. So we really need to make sure na nakahanda jud dato ang antidote dyan. And then dagan pa man to siya, ma'am, pero straight to the point. And then sa anti-angina man, ma'am, kay we have those yung disease na angina pectoris, which you have differentiate it with myocardial infarction na kapag sa mas malala ang myocardial infarction, ma'am, in terms of its pain, ma'am, kaysa anginal pain, kay chest tightness, ma'am, na mag-extend siya sa center of the chest, radiating down to the neck, to the left arm. Sa myocardial infarction naman, ma'am, kay man to yung parang stabbing siya, ma'am. Parang ganun yung feeling, ma'am. So we really need to make sure na yung mga types of angina, yung specify ang mas nag-focus maguto sa ano ma'am sa anti-angina na medication such as yung non-nitrates and then yung nitrates. Pero yung sabi niyo ma'am kay sa myocardial infarction, yung ginahatag nato usually is morphine, di ba ma'am, na medication to assess that kind of illness. And when it comes to the nursing intervention, you need to assess the chest in terms yung participating factors, quality, radiation, severity, and then yung time niya ma'am para ano. And yeah, we have set of different routes for that kind of medication ma'am. So we really need to take note of that, such as yung mga PO medication, SQ, buccal, IV, patch, ointment. Although dili na siya ginaano ang ointment ma'am, pero gi-appeal gyapon nato siya ma'am. And then sa pagganito siya, yun lang specifically sa ano ma'am, sa cardio, ano ito, sa cardiac glycosides and anti-angina ma'am. So, yun po ma'am. Doon lang specifically. And
Okay.
yun ma'am.
Thank you, Lauren. So I'm amazed. No, thank you, Mr. Dicken Cheng. So you did basically, no, studied, no, or more than like checking into like more details, no, kasi hindi ko naman din dimension yung differentiation ng angina Nawala ako, no. Saan ako nag-stop, Lauren? So, happy?
Yun
No,
sa
I'm happy. Okay,
differentiation no?
kasi you did go beyond, no, that learning, no, na specify pa. Kasi basically, ang angina pectoris is the starting point of a problem of hypoxia to the myocardial cells, no? Di ba? When terms that we use in the hospital na ay hypoxemia ang pasyente because of low cardiac output, ang development ana is basically hypoxia, no, or less oxygenation to the tissues. And of course, we all know that our body would be composed with a lot, millions, billions of tissues, and one of which is, of course, the myocardial cells, di ba? Tingnan niyo ang forma ng heart, di ba, mas malaki ang left ventricle, no? Because sa left ventricle, andoon nakaposisyon ang larger areas of your myocardial cells, no? Because it is the left ventricle which is responsible in pumping out the oxygenated blood going up to the aorta and to the systemic circulation. Tama? Kaya over time, ang mga tigulang, mapansin nato pag mag-2D echo na, no, kana mga cardiovascular diagnostic imaging test, makita talaga na ay LVH or the left ventricular hypertrophy. No, mao na siyang ginaingon na napapagod din ang puso, no? Wear and tear theory, no, sa inyong GERIA later pag mag 4th year na kayo. Okay? So nonetheless, ato ang mga elderly clients na to or those little children or babies nga mga premature that were born out of like congenital heart disease, no? They would actually take medications like your digoxin or the cardiac glycoside, no? Because the cardiac glycoside would be responsible also in like giving out the calcium into the myocardial cells, no? Kasi ang main purpose niya is it causes the cardiac muscle fibers to contract effectively, no? Kasi 'di ba pag dili siya labdab, so dili siya haom, no? So that would not be enough to suffice for the perfusion of major organ tissue. So that's basically like low cardiac output. no? So dili makaya. So pag nakulangan ng dugo ang highly vascularized organs, ano yung mga highly vascularized organs nato? Of course, the liver, no, which deals with metabolism, more so with the kidneys, no, which deals with filtration. So pag nakulangan ng dugo, itong mga organ system na to, including the heart, no, kaya nagkakaroon ng hypoxic episodes, mamatay, no, mauna siyang myocardial ischemia, no, which means na ang itsura ng tissue nangingitim-ngitim na. Pag hindi siya naagapan, hindi siya nabigyan ng vasodilator, or hindi na-address ang problem, pintahay na gyud siya occlusion dito, na kailangan talaga siya angiogram, no, or you have the placement of the stent, no, para i-thread padulong dito sa tiny vessels in the heart in order for that vessel to dilate, no, kanang stent ba, no, that's basically an appliance na gina-apply na siya sa, or ginalagayan siya sa mga coronary artery, no, kung asa dito ang blockage, or the cabbage, no, or the coronary artery bypass grafting, no, na kanang magkuha og kanang ugat dito sa gastrocnemius or sa calf ng pasyente para ilipat doon sa heart para magkaroon siya ng passageway, no, kanang mga ana na mga management, no, kasi pag hindi din siya ma-manage, eventually, no, continuously mag-hypox siya, no, there would be myocardial infarction, there would be necrosis, and there would be tissue death, no, so domino effect na siya. So itong ating pinag-usapan na cardiac glycoside, no, basically it's one of the oldest medication, no, the digoxin or digoxin kung nasa sa States na ka mag-nurse, no. So it's a tiny white pill, no, maliit lang talaga siya na pill. And of course, we also give this digoxin to our pediatric patients in San Pedro Hospital, no, kanang mga congenital heart disorders nato, na mga pediatric cases nato. But of course, you all know sa factors na, of course, if the age of the patient is like young pa siya, mas lesser ang kanyang dosage, no, kasi ginaiwasan natin ang toxicity. So na-mention din ni Lawrence kanina na ang trabaho or ang mode of action ng cardiac glycoside is working out on the action potential of the heart, no, yung ating depolarization. So pag sinabi nating cardiac depolarization, letter D, dog, that's basically contraction. Pag repolarization, RE, relax. So that's cardiac relaxation. 'Di ba? Naisip ninyo ang ECG? ECG na itsura, yung PQRST, di ba? Familiar mo ana, no? Kasi naana siya sa, of course, sa ato ang Facebook, makita nato, or sa Quintas, or sa t-shirts, di ba? Ginagamit din yan siya ng RT sa mga mga design. But you are basically familiar with the ECG tracing or the electrocardiogram, which is basically a diagnostic test also to check for cardiac dysrhythmias. Ha? So pag nakarinig ng cardiac dysrhythmias, no? So these are irregular patterns of your tracing or heartbeat, no? So mao gyud na siya ang ginatan-aw pod, especially pag once na naanay problema ang pasyente, no? So sa cardiac tracing, you have the PQRST wave, no? Pag sinabi nating P, yun ang simula, no? The P wave is basically the atrial contraction. Tapos ang QRS complex, no, medyo meron siyang spike, no, kasi that would mean ventricular contraction. Mas malakas kasi ang force ng ventricles, di ba? Kasi from the atrium, munaog man siya padulong sa ventricle, unya si right ventricle, iyahan na pong i-pump out ang unoxygenated blood going to the pulmonary artery, no? Because the pulmonary artery is the only artery which carries what? Unoxygenated blood, no? So si pulmonary artery, di paadto siya dito Asan ako, nawa ko, Miss Asturias. Nakasabot, Miss Asturias. Murag nag-uul man ni kaayog naong si Miss Asturias. Uy,
Sa oxygenated blood ka po, Ma'am Bandan.
pura naman ni. Humana ba yataan ni sa anatomy pag sure mo diha. Di ba, Miljan? Nagkatawa, nag-uul kung tanaw kay Kinsel ba? Kay murag yun siya, na gid kayo hang naong nga duol pa gid kayang naong sa camera pag sure diha Asturias, ha? Nakapasar ba ya mo og anatomy? No, bago mo nag NCM 206. Pastilan, corazon. Pulmonary artery. Pulmonary artery carries what? Oxygenated or unoxygenated blood? Kinsel. It's the only artery which carries. Sige, Divino. Sige, Asturias. Unsa man?
Oxygenated, Ma'am.
Okay, oxygenated. Oxygenated, ha? Makinig, no? So pag ato karon sa unoxygenated blood sa lungs, no, i-perfuse tapos mag gas exchange para papasok ang oxygen. So pag na-oxygenize ng blood, babalik siya sa left atrium via the pulmonary vein. Tama. So dadaan siya sa mga valves, 'di ba? Mga mitral valve, tricuspid valve, okay? Pupunta siya ng left ventricle and then ipapump out ngayon ni left ventricle papuntang aortic valve para maka-pass through siya sa largest artery which is the aorta, no? Carrying the oxygenated blood going into the systemic circulation. No, mao na siya kung naay coronary artery disease, no, na naapektuhan ang large arteries in the heart which supplies oxygenated blood, kung naay mga cardiomyopathies, no, na there is enlargement of the myocardium, kung naay hypertension, kung naay mga valvular disease ang pasyente, nagkakaroon ng problema in the cardiac output. Okay? So, kailangan i-maximize talaga ng gamot ng cardiac glycoside, no, ang contraction ng heart to contract effectively with the aid of the calcium. Okay? Mauna siya. So, with that, no, pag natrabaho na to ni digitalis ang pag-entry ng calcium into the myocardial cells, gumaganda na ngayon ang action potential ng heart, no? So what would be the three effects na mention ni Lawrence yon? One is positive inotropic action. So that's basically increase in the myocardial contractility, and there would be decreased chronotropic. Chrono means time, di ba? Or watch. Chrono, no? Decrease in the heart rate. And then you also have negative dromotrophic action, no, wherein there is a decreased conduction velocity through the AV node, no. Murabag niingon ang tambal nga o daraha digoxin pagtrabaho diha para dili kaayo ma-stress ang heart, no, para okay ang iyang contraction, lumalakas ang contraction pero pinapababa niya ang heart rate para makakompensate ng maayos at pinapababa niya ang conduction potential, no, through the atrio and ventricular node, no, para dili dayon magkasalimuang ang heart, no. So basically that's the action of the digitalis. All right? So with that, the bottom line, no, tataas ang cardiac output. No, magiging okay na ang cardiac output pero dili din na siya super okay kasi meron na nga ang mga causes na yan na kailangan din i-manage, no, but nonetheless nagkakaroon ng improvement at nape-perfuse, no, ang major organ system such as the kidneys, no, and then there would be fluid release or excretion to lessen out the edema. No, that's also the good side of the digitalis or the digoxin. Okay, so it is indicated for congestive heart failure, for atrial flutters, no, kanang mga nakikita sa ECG tracing, no, atrial flutter or your cardiac dysrhythmias, kana mga uncoordinated contractions, no, of the atrial myocardium, and you also have rapid contractions, no? Kung ang normal heartbeat is 60 to 100, ang atrial flutter or atrial fibrillation will go up to 200 beats per minute. No? So, i-manage good siya. No? Mao nang hatagan og cardiac glycosides, tapos napagipakapin nga beta blockers. Did you understand? No? Para dili makapoy ang kasing-kasing. No? And of course, what is also important with the digoxin or your digitalis glycosides, cardiac glycosides, is the toxicity. No? Since it's very potent, no, it has to be checked with its toxicity levels. Okay, so we have always to prepare, no, sa cardiac center nato, sa emergency cart na agad may mga antidotes, no, on the e-cart. Okay, so you have the immune fab, no, for therapeutic serum levels of digoxin which reaches more than 10 nanograms per ml, no, kasi ang therapeutic levels would be 0.5 to 2 nanograms per ml, no. So pag inunan yan siya sa dugo, kasi unsa man ang intention nato kay nakitaan nato og digoxin toxicity signs ang pasyente, no? So one of which is gastrointestinal problems. Very common siya sa mga pediatrics nato na ato ang bantayan, no? Kung nakalanoxin gani si baby, no? For quite some time, no? Tapos nag-diarrhea, nagasuka ang pasyente nga bata. So that's basically a sign of your digoxin toxicity. So kinukunan kaagad yan siya ng serum sample or blood sample to check for the therapeutic index or the range, no, of the medication that is running in the circulatory system. So pag mataas, especially pag severe na siya na toxicity like 10, more than 10, so ginahatagan na dayon siya og intravenous digoxin immune fab, no, just to counteract the problem. Okay? So, meron din for adults naman, ang nakikita natin na digoxin toxicity signs would be like headaches, no? You also have decrease in the heart rate, bradycardia, confusion, delirium, no? Ana na ang makita sa pasyente. Nagasuka po sila, nagakalibanga. And mag-ingon sila nga, hala ma'am, nalagi ko'y makita sa ako ang visual ma'am, no? Nalagi yellow siya ma'am, unya murag blurred, no? So that's basically visual illusion, which is also indicative of digoxin toxicity. Klaro? Naintindihan ako? Hindi ako putol-putol, Miss Relion?
Sa akin lang ata to na ma'am nakadata maganda ko pero gets man ang ibang part.
Man, okay. Sige ha. So that's your digoxin. All right? So ano pa ba ang importante? Therapeutic levels. You also have the signs, no, na tan-awon ninyo for pediatrics and for our adult patients in the hospital. Kasi common talaga siya. Then we move on with anti-angina. Ang sabi ng mga cardiovascular doctors nato, pag ang pasyente na ay congestive heart failure, no? Heart failure yun po na siya in layman's term. Kasi sira na ang basically pila ka percent na lang ang ejection fraction, nakukuha ang ejection fraction sa 2D echo, no? So it has to be like more than 50% para sa mga tigulang, no? Or 60, 70%. No? Pero if it reaches below 50, no? Kung naga 40% ejection fraction, 30% ejection fraction, so alarming na pud na siya for our patients, especially our elderly clients nato. Kaya meaning to say, low na din ang kanyang cardiac output. Kasi nga, meron na siyang heart failure. So, ibig sabihin, endpoint na gyud siya, no? And usually, ang naga-heart failure, kato na mga above 70 years old, no? Mga 80 years old na to na mga pasyente. no? Kasi nga matanda na din sila, no? Pila na sila 80 years of existence in this world, no? With a lot of like circumstances nga nahitabo sa ila, no? So eventually, no, naanay problem sa heart. So pag na CHF, ang ato ang bantayan is basically kanang pulmonary congestion. Okay, maunang ginahatagan og cardiac glycoside, no, mga beta blockers, diuretics kay ang ato ang iwasan dili makaginhawa ang pasyente, no, with congestive heart failure. So in the true sense, no, what we do, the medical healthcare team for such case, we will just do palliative management. Did you understand? Pag nakarinig kayo palliative management, ibig sabihin, kung nahihirapan maghinga kasi naga-congest, hatagan dayon siya og diuretics, no? Kung naga-chest pain siya, hatagan dayon siya og nitroglycerin or naa siya'y eye socket na maintenance, no, which is the nitrates, no? So pag unstable naman ang kanyang blood pressure, tumataas, bigyan siya ng beta blockers kasi maganda din ang beta blockers for those patients nga naay problema sa heart. Okay? Ma'am, nagababa jud kayo iyang heart rate, ma'am. O, bigyan ng amiodarone, no? Para tataas na naman ang kanyang heart rate. So, things like that. So, naga-evolve lang yun siya with the medication. Sana lang na siya to prolong life. But, nonetheless, it's very important na naagyo evaluation sa doktor. No? Kasi pag hindi yan na-evaluate na kailangan na pala tanggalin yung kanyang amiodarone, i-lessen na lang ang kanyang beta blockers, tapos taasan na ang frequency ng kanyang diuretics, things like that. So it will actually help the patient. Okay? So sa ato na pong anti-angina, we have two types, no? Katong nitrates and non-nitrates, no? So kasali sa non-nitrates yung beta blockers and the calcium channel blockers, no? Kasi it would also give an effective contractility, no, sa ato ang heart because of the beta 1 blocker, no, at saka yung ating calcium channel blocker. But nonetheless, very specific in the hospital that we give the nitrates, no, because the nitrate is much more effective since it's an organic compound and it has a better mode of action in relaxing the blood vessel wall, no, in the coronary artery, thus increasing the perfusion in the heart. Kasi pag poor perfusion, less oxygen, there would be ischemia. And the ischemia is a damage on the myocardial cells. If there is a damage, there is an inflammation. Pag na-ay inflammation, na-ay pain. Alright? Pero as nurses like you, Section M, kinahanglan good inyong assessment, especially if you're gonna be assigned in the emergency room, no, or you are taking care of the patient. Kaya ang mga tigulang, no, naana sila tendency na magsakit ilahang puto-puto. Okay, so ang kamot nila naa diri sa ilalom sa ilahang like in the epigastric area. Okay? So they would tell you, hapdos man akong tiyan, no? Kasukaon man ko, no? So are you gonna be assessing that one as an angina pectoris? No? So dili pa, no? Kasi murabag, ma'am, unsa da imong gikaon, no? Nagkaon ka ba? Taas luman akong tiyan, no? Pero kung naga-stay lang diyan sa epigastric area, hindi naman siya naga-radiate. So that's basically not a chest pain, no? Kasi ang ato ang angina pectoris galing sa torso, no? You have the universal kuan man guna siya, universal sign, no? Na nakaana ang pasyente sa iyahang heart. Tapos radiate pa gyud ang pain sa neck going into the shoulders down to the forearm and then at the back. So that's a significant finding of an angina pectoris and not an epigastric pain due to hyperacidity, or chest pain due to costochondritis, di ba? Kabalo man ang costochondritis ka na magsigig ubo-ubo ang tigulang, ma-strain ang iyahang muscle area, skeletal area on the rib cage, no? Mo nang may costochondritis, kaya lisod pod para sa mga tigulang o yung parating ubo ng ubo, no? Because that would be painful for them, that would be uncomfortable for them. Okay? So, yung sinabi din ni Lawrence na merong distinct signs ang myocardial infarction with the angina pectoris. Okay? Kasi ang angina, starting point na siya nga naanay myocardial ischemia. Pero pag naanay MI ang pasyente, ibig sabihin necrotic na, no? Nasira na ang portion doon sa myocardial cells, no? In the area of the heart. Okay? So pag nagkaroon na ng ischemia, nasira, necrotic na siya, mauna din na siya ang myocardial infarction. Maunang kailangan na siya og other medications like your thrombolytics, no? Kasi 'di ba sa inflammatory response na learning nyo, 'di ba pag na ay inflammation, there would be platelet aggregation, 'di ba? Or if there would be erosion of the vessels, no, nagkakaroon ng clumping together of this cellular debris, di ba, which can lead to obstruction of these tiny vessels inside the heart. And worst case scenario, pag merong clot sa heart at na-dislodge siya, nagiging embolize, no? Sobrang maliit na blood clot na traveling clot ang tawag natin kasi na-dislodge man siya. Ang problema, asa man na mo adto ang emboli, no? Kay sobrang liit niya, pwede siyang dadaloy sa circulation. So what if papasok siya sa respiratory system na sobra tiny vessels ang andoon, the bronchioles, no? The respiratory vessels na pwedeng mag-pulmonary embolism yung pasyente, mamatay, no? Diretso, di na sa ginhawa. No? Kaya maraming cases like here in the Philippines, kaya wala man tayo CT scan, no? Namatay ang pasyente, cardiac arrest. No? Pero little that we know na nag-pulmonary embolism pala yun, hindi lang nakita. No? Kasi hindi naman siya na CT scan, hindi naman siya na present sa diagnostic imaging test, 'di ba? Kasi dili man sa makita kay sobrang liit niya. Okay? Kaya importante din ang assessment ng PQRST, 'di ba? P is the precipitating factor. Ma'am, no, unsa man day nahitabo, sir, no? Kung of course, you do your interview pag na-manage na ninyo ang pasyente, dili po kag interview unya nag-chest pain ang pasyente, wag gyud ninyo gihatagag sublingual nitroglycerin. Okay? But it's very important to do assessment. No? Anong nangyari? Precipitating factor. Unsay naka-aggravate sa scenario. Then the Q quality, kasi nga, no, you have differentiation of the angina and the myocardial infarction. Okay? Pag hindi na manage ng nifedipine sublingual or nitrate, ang kanyang pain, ibig sabihin, myocardial infarction na yun to because the only medication which can treat myocardial infarction is the morphine, no? So, yung nitrate natin, no? The nifedipine sublingual, ikatulo ka maghatag, but on the third dose, sobrang sakit pa rin. So, meaning to say, nag-MI na yun yung pasyente, no? Mo na siya ang management anak po, no? Another medication has to be given. Okay? So, nitrates, no, very important, being given sublingually. Okay? It could also be given buccal, no? Alam niyo, buccal sa gilid lang ng cheek or the spray, no? Naapod tayo nitrate spray. But here in Davao, what we observe is the nitroglycerin, no, tablet. No, it's basically a gel na tinutusok natin with a needle, tapos no, ilagay lang natin yung liquid sa ilalim ng tongue, no, kasi soft gel man siya. Pero meron ding nitrates na capsule siya, tablet siya in form na matunaw lang po niya. So we never give water, no? In such cases. So pwede natin painumin ng tubig before mo siya isublingual. Pero pag andyan na yung kanyang gamot, huwag mo na painumin ng tubig, no? Because it would disrupt the absorption process of the nitrate. Okay, we give it 3 times. You have the start dose at 9 o'clock. Okay, and then you do assessment, and at 9:05 you give the second dose. Okay, and then you give the third dose at 9:10 a.m. So it basically pagbigay mo ng gamot ng third dose niya, so that's 10 minutes, that's the time na maka-feel na ng relief ang inyong pasyente. Okay, but nonetheless, you still have to place your patient on a comfortable position. If she needs oxygen, so you have to administer oxygen, no, per nasal cannula. Okay, so nasal cannula, that's basically 2 to 3 liters per minute, no, na oxygen, no? Kasi nga nag-hypoxic na siya. If there is pain, kailangan tala ng oxygen, no? So when I actually had experienced abruptio placenta on my second child, no? You know, so from your maternity, abruptio placenta is the most painful in all labor and delivery, no? Kanang abruptio, di ba? Nag-lesson na mo, ani? Abruptio placenta? Yes or no?
Wala pa.
Delivery room naman mo, di ba? DR naman.
Pero feel na ko ma'am sa second sem pa ata yun siya i-discuss or ano pa lang ni ma'am yung procedures
normal. Normal po inyong ha, di ba?
Yes,
Normal delivery.
normal pa yung mga
Sige lang. Segue lang tayo. So pag abruptio placenta, naibot, no, natanggal ang placenta, no? Kasi pag labor and delivery, sudden gush of the fluid, no, of the amniotic fluid, tapos nag-cord coil pag yun ang baby. So pwedeng mabira during the sudden gush of the amniotic fluid. So naibot, no? So that's basically 40% of my placenta was, no, naukang siya, naukang. You know what's ukang? Kasabot mong Bisaya, di ba? Nadira siya. So natanggal siya dito sa uterus, and there is basically bleeding kasi natanggal naman siya na hindi pa man siya dapat natanggal kasi hindi pa nakalabas yung baby, no? So I had actually emergency cesarean section, no? Kasi nag-deteriorate na ang heart rate ng baby kasi nga nag-gorgoy, tapos no, nabira pa yun siya, naukang pa yun ang placenta. So instead na fluid ang lumabas, dugo na, no? And I was basically on that DR table in San Pedro Hospital. Can you imagine? Pinaka-painful sa tanan painful, di ko kasabot on sound pag-explain to the point na di na ko kaginhawa. So that's basically, I had experienced that one. So kabalo jud ko unsa ang feeling, kung unsa kasakit, no? And to the point na if there is extreme pain, no, you cannot really breathe, no? Wala di oxygen. And no, causes yun nga, yung sudden gush of the amniotic fluid, kanang nikalit sa buto and then nag-contract ang inyong ang ako ang tiyan, no? Kay nag-labor naman. So contraction, sakit na gani kayo ang contraction, no? Pag mag-anak ka, labor, that's basically for 12 hours, no? For preemies, di ba? Naintindihan ang preemie? Naintindihan ang preemie? Di ba? Preemie para ba? Di ba? Preemie para, multipara. Di ba? So, first time nga nanganak. So, preemie. So, that's 12 hours, basically, magla-labor. No? Pero kung multipara na, ikapila na nimo na anak, so basically, 6 hours na lang imuhang labor. Alright? So, ayun. So, my story is, pag sobrang painful, no, like myocardial infarction, labor and delivery, pag nilagyan ng nurse ng oxygen ang pasyente, murag yug na ukang ang imuhang blood vessels, no? Meaning to say, nag-vasodilate, na nakaginhawa ka, nga at least man lang na-ease mo ang pain. Okay, that's how important oxygenation is. Okay? Nurses can actually initiate, no, nasal cannula oxygenation for 2 to 3 liters. Even if without doctor's order, pwede naman, no? Especially pag na-assign ka na sa critical area, no? Critical care nurse ka na in the ICU, emergency room, no? So that's how important it is, no? The oxygen. Sige. So, yun, nitrates, no? Sublingual, buccal, spray, and what else? Yung ating patch. Alright? So, yung patch, very common yan siya ngayon, no? In the hospital. We are using that one. Before, when I started teaching 2000, kailan ba ako? 2004. Alright? So, 2004, naabutan pa namin with my students ang ointment, no, na nilalagay natin sa patch, no, parang nakapack siya, tapos meron siyang ointment, naapod siya yung murag bandage, no, so it's like 4x4, no, ang size niya. So ikaw pang maglalagay nun. Pero ngayon, no, diretso na siya, no, the Nitrodur, the nifedipine patch, no, nakalagay na talaga doon ang cream, no, doon sa parang bandage-like patch. So, ang trabaho natin is of course to administer. No, student nurses are also allowed to administer the patch, no, with the assistance or with the facilitation of the CI. Importante na mag-gloves jud ka, no, in handling medications, potent medications, no, kay pag once na mag-touch sa imuhang kamot na naka-bare hands ka lang, of course, that would be like introducing microorganisms, no? Wala na kayo nagkuan sa aseptic technique. Much more nga, pwede po siya na mag-cause po siya og side effects sa imuha, no? So, mga side effects like bradycardia, reflex tachycardia, headaches, hypotension, no, nausea, vomiting, because that's basically the side effect. Napunta tuloy sa'yo kasi di kamay mo man yung gamot. No? Kaya very important na mag-gloves talaga. Alright? So, saan ilalagay ang patch? Diri ba sa agtang, sa pasyente? Sa ibutang. Sa ibutang ang patch. Bidalbe, Romero, Leonard, are you with us?
Yes po.
Sa ibutang ang patch. Nitroglycerin patch.
Idea po.
Sandali lang, Miss Tatalcorin, ha? Lebrillo. Mga naka-offline dito, sagot-sagot, magparamdam kayo. Muratag nag-spirit of the glass diri. Romero. Sa ibutang. Ang patch. Sa knees, sa tiyan, sa agtang, sa batok, man. Romero, tubag. Kung di ka tubag, moingon lang, ma'am, I do not know the answer. Basta alam ko, andyan kayo.
Sabi kanina ma'am na
Sige, Lebrillo, balon. Naaka, Miss Balon? Okay, sige. So, nag-answer na dito si Miss Tatalcorin, anterior chest wall. Okay, so that's the anterior ACW. Okay, anterior chest wall diri. Okay, anterior man posterior man sa likod. Okay, upper chest, sabi ni Miss Hitolana. Upper arm, dili pwede sa arm. Okay, kaya ang ato ang heart na sa ato ang chest. Alright? So, sa anterior chest wall, okay, non-hairy, okay, kaya basi natin mga Arabo, dili pwede sa abdomen. Okay, kay ang heart, asa man ang location sa atong heart, diri man, no? Sa breast area. So, doon din kayo maglagay. Okay? So, alternate lang ta. No, pwede din actually sa back, no? Pero in our experience, wala mi nagabutang og tawag nito patch sa likod kasi direct tayo dito sa chest area, no? Para mas effective ang kanyang efficacy. Maganda yung kanyang effect. Alright? So, anterior chest wall, non-hairy, no? Kay mura kag nag-waxing, anak, pag ibot nimo sa patch, kung daghan kay balahibo ang imong pasyente, no? Adding insult to injury ka, no? So, kung merong mga balahibo, magpaalam tayo, magpa-consent na pwedeng i-shave, no? Para malinis lang ang area. Okay? Kasi mahirap din maglagay ng patch, di ba? Kung maraming balahibo ang pasyente. Wear your gloves, okay? Then, we have to maintain and to avoid tolerance, no, to the nitrates by rotating the sides, no, or you have to just put it on the right or on the left upper area or just lower but not in the abdomen, okay? Para different sides lang siya. Then before you apply the next patch, no, you have to be sure na malinis, napunasan ang pasyente ng maayos, no? Kasi you do not want to leave any debris or cream on that area. No? Nagipatong-patong lang nimo na siya diha because there would be rebound effects, no? Mga reflex, tachycardia, rebound, chest pain na mahitabo sa inyong pasyente. Okay? So, we also have to maintain no nitrate time, no? Just to avoid tolerance to the medication. So, no nitrate time for 8 to 12 hours. Alright? You have to maintain that one. So, kung alas 8 nagbutang si Nurse Lucino Rhea dito sa left anterior chest wall, so 8 o'clock sa morning, so tatanggalin ngayon ng 3 to 11 shift na si Nurse Estino ng alas 8 ng gabi. Okay? Tapos si 3 to 11, Nurse Espino, mag-endorse karon kay Nurse Iba sa 11 to 7 shift na alas 8 pa ang next niya na time. Naintindihan? No? Naintindihan? Okay? Kasi kailangan natin i-maintain, no, ang efficacy ng gamot and we avoid tolerance and untoward effects to the client. Kasi potent nga siya kasi topically applied. Okay? I hope that is clear. Medyo putol-putol ako, pero mo na siyang importante, ha? The quality of your care is very, very important when providing this management. Okay? So, ang nitrates would also increase blood flow through the coronary arteries to the myocardial cells, and it has the capacity to reduce myocardial ischemia, but can cause hypotension. Okay, because of the vasodilation, ha? Kaya vital signs is also very important. Okay? So, pag sublingual din naman, no, yung ating 3 doses every 5 minute interval, 3 doses siya ng nitroglycerin. So, pag nakaramdam ng stinging sensation si pasyente sa kanyang dila or mainit yung kanyang pakiramdam sa kanyang bunganga, that would be temporary. Do not be alarmed, and it would just mean na nag-work na ang sublingual medication. Okay? So that's part of the absorption process of the medication. All right? So that's your anti-angina. Any questions? So far, so good. Nasabtan? Okay? And another thing sa mga gamot, especially the nitrate patch, no? Dili man na siya forever na ibutang permanente sa pasyente, no, in cases of like acute siyang iniinom na sublingual or nag-nitrate patch siya, or paglabas niya is basically nag-inom na siya nitong maintenance dose of the nitrates, no? Example niya yung mga Isoket, Imdur, no, isosorbide mononitrate, no? So those are for chest pain, which can be taken per orem as a maintenance dose, no, just to avoid chest pain. Okay? Usually ang congestive congestive heart failure, no, doctors would tell us na katong mga naay heart failure dili na gyud na sila maka-feel og chest pain. No, wala na sila evidences nga chest pain ang ilahang problem, but more so ang ilahang problema is edema and pulmonary congestion. No? Bakit wala ng chest pain? Kasi mismo ang kanyang heart naa na gyud siya sa heart failure, so basically mura nag-numb na ang ilahang muscle, no, mo nang dili na kayo evidence sa ilaha ang chest pain for congestive heart failure, no. Pero mga coronary artery disease, no, mao na siya naagi mga chest pain, okay, mga cardiomyopathy, no. Pero eventually pag nag coronary artery disease ka, long-standing cardiomyopathy, tapos na yung mga valvular heart disease, ang endpoint ana nasira na ang heart, yun ang congestive heart failure. Okay? So yun. Sige, so we move on. Are we good? Can I see a reaction on your screen? Especially those who are off-cam. Okay lang ba tayo? Alright, naintindihan naman ang mga discussion at mga important matters for student nurses. All right. Sige, so let's move on with the drugs affecting blood coagulation. Importante po ni siya because when we say thrombosis, no, it's basically a formation of a clot, no, in an arterial or venous vessels, no, sa mga blood vessels natin. Delikado 'yun, 'di ba? Pag may mag-clot kasi doon na ang sequence nun is going towards, no, your coronary artery disease, myocardial ischemia, myocardial infarction, no, thrombolytic stroke. Naintindihan? Thrombolytic stroke kanang na ay nagdugo, no, na ay aneurysm, no, kasi because of long-standing hypertension, no, so nagkaroon ng clot sa central nervous system. So mahirap 'yun. And sa discussion ko sa blood coagulation medication, na-mention ko rin ang plasmin, no? So the plasmin is an enzyme present in the blood that degrades the fibrin clots. Okay? So the fibrin clots would be a protein which involves in the clotting process of the blood. Okay? So bago siya maging nagkakaroon ng release of the fibrinogen which leads to fibrin clots, na ang fibrin would create the meshwork, no, in the circulatory system, meshwork no, murag spider na didto magdikit-dikit, no, ang mga fibrin clots, no. But because of the beauty of our anatomy, physiology, na ay plasmin, no, na ginapagawas ang atoang lawas para eventually matunaw lang pud tong clots. Okay, no? So plasmin is a very important enzyme in the body kasi ito siya ang nagadegrade sa fibrin clots. No, but somehow because of diabetes, unsa may mahitabo, no, there's basically pag diabetic ka, masyadong malapot ang dugo mo, no? Prone ka sa hypertension. Pag mag-hypertension ka pud, ma-erode pud ang imuhang blood vessel lining. So magkumpul-kumpul na pud ang platelets diha because of the injury and inflammation. So namuuna naman ang clot. So, dili na matabang sa plasmin kasi mismo ang katawan, no, merong problema, no, hindi na healthy. So, ngayon, merong gamot, no, of course, na pinalabas ang pharmaceutical companies para matabangan, okay, para ma-help lang to prevent this clot to be formed, no, kasi delikado siya. Na-mention ko yung pulmonary embolism na bigla na lang nag-upo ka, tapos bigla na lang ka na wala ka na-collapse na ka diha, or nag-aneurysm ka, simba ko palayo, nag-istorya diri, kunya perting na high blood, no, kay nagyaw-yaw sa mga estudyante, kay nagsapot na, kunya nag-hypertension, ikalit lang og tiyong, simba ko palayo, no, nag-aneurysm na di ay. no? Nag-stroke na di ay. So things like that. Kaya meron tayong maintenance talaga, no? For those patients na probable na pwede silang they have these factors nga pwedeng maka-aggravate into like formation of clots, no? Like the hypertensive clients nato, no? So we have divided these medications into 3 major groups, no? Because these drugs would actually maintain or restore the circulation. All right? Number 1, anticoagulant. Okay? So anticoagulant, ang trabaho ni anticoagulant is to prevent the formation of clots. Okay? Pero andyan pa rin, no? Pwede pa rin mabuo ang clot, kaya lang si anticoagulant, no, magtabang siya sa pag-interfere with the normal coagulation process. Naintindihan? Kaya, at the back of your mind, you will see that or you will know that anticoagulants are actually maintenance, no? Pwede siyang pang-maintenance ng pasyente ninyo. Okay? But of course, meron din tayong uri ng anticoagulant na binibigay siya during also acute cases or emergency situations like the heparin. Okay, nakarinig na kayo ng heparin, di ba? Ginagamit nga ang heparin ng RT, no, nilalagay ang heparin sa kanilang ABG syringe, no, para dili mag-clot ang dugo, no, while they are actually extracting or collecting blood sample. Okay? Kasi heparin is a anticoagulant. Okay? So, ang trabaho ni heparin is to inhibit the conversion of prothrombin to thrombin, thus blocking the conversion of fibrinogen to fibrin, which is kasi na sequence ana, no, in the formation of the clotting mechanism. Okay, mag-fibrinogen into the mahimo na pong fibrin. Okay. No, that's basically the protein which involves fibrin. Actually, bad in the sugatan ka at nagdugo na imuhang kama. So, good side gihapon siya. But somehow, we are talking about disorders, kaya bad siya na type of like fibrin clot release. Alright? So, the heparin is being given subcutaneously and intravenously. Okay? And it has an immediate onset. Okay? It does not cross the placenta. It does not enter the breast milk. And it cannot be given per orem, only subcutaneous and IV because it is poorly absorbed in the gastrointestinal tract. Okay? Ang heparin, di na siya ipainom, i-injection yun na siya. So, good for the pregnant mom, kaya this is the drug of choice also for pregnant women who are experiencing or who are diagnosed with antiphospholipid, no, syndrome or the APAS. Kana ganing magbuntis ang mama sa inyong maternity ha, pag second sem ninyo kabalo na mo og abruptio placenta ha, og APAS ha. So, yung APAS kasi is like hereditary siya or somewhat unknown etiology na pwede lang mangyari sa mama na pag nabuntis siya, dili compatible ang dugo ng kanyang baby or fetus and the mom, which leads to coagulation process, no, para sa mama, no. So pag nabuntis siya, nagkakaroon siya ng possibility na mag-create ng clots inside her system. So delikado po to, kay pwede ma-stroke ang mama, di ba? So in that sense, ang management naman para mabuhay si baby at hindi madelikado si mama, mag-injection si mama ng heparin for the rest of the 9 months pregnancy. Okay? Para lang maglapot ang kanyang dugo at hindi magkaroon ng clot formation. Alright, so that's your positive, no, moms, na heparin ang ginahatag. And heparin is also intended in the treatment and prevention of venous thrombosis and pulmonary embolism, katong mga atrial fibrillation, di ba? Kasi pag colicky ang heart rate or masyadong increase ang heart rate, no? Nagkakaroon ng increased peripheral vascular resistance on that vessel, which might erode, no, the tissues, which may lead to clot formation also. No, na ang heparin would also be a drug of choice for cardiac dysrhythmias. And it would also be used, the heparin is also used to prevent clotting of blood samples in dialysis and venous tubing, no? Para sa katong mga ABG ng ating mga respiratory therapies, no? Heparinized syringe ang tawag nila. Okay? So makadungog mo ana. But since heparin is acting on the prevention of thrombus formation, so it thins the blood. Blood thinner ang tawag kasi sa ating mga blood coagulation medication. Okay? Anti-blood coagulation or the blood thinner. So, ibig sabihin kailangan ng antidote. Ano ang antidote ng heparin?
Protamine po, ma'am.
Okay, so you have protamine sulfate. Alright. So, protamine sulfate is readily available in the emergency cart kay in cases na nakitaan sa laboratory tests like the clotting and the bleeding time of the patient. So, itong mga activated partial thromboplastin time, no, na sobrang haba ng result. Ibig sabihin, pag sobrang haba ng seconds, no, matagal mag-clot ang dugo, so pwedeng magdugo ang pasyente. Okay? Kaya binibigyan siya ng antidotes. Alright? So, after heparin, pag tapos na siya sa kanyang heparin, pwedeng may maintenance siya. No? So, after the heparin, the warfarin is the next medication to be taken by the patient since the warfarin or the Coumadin is a PO medication. Okay? So, yun ang next na binibigay sa pasyente, no, na oral anticoagulant. Okay? And the main action of the Coumadin or the warfarin is it would interfere the formation of vitamin K. Okay, so vitamin K is would inhibit hepatic synthesis, no? The Coumadin would inhibit hepatic synthesis of vitamin K, thus affecting the clotting factors. Okay, so kaya since ang green leafy vegetables would contain vitamin K, so pag nakakumadin ang pasyente, avoid muna taking the green leafy vegetable because it would counteract the action of the warfarin since the green leafy vegetables would contain the vitamin K kasi ang antidote ng warfarin is the aquamephyton or the phytonadione or the vitamin K. Okay, so yun siya. And when the patient would take the warfarin, no, per orem, the onset would happen on the 3rd day. So hindi din siya agad-agad. Unlike sa heparin na faster ang kanyang bioavailability, but the Coumadin or the warfarin, it would take 3 days, no, bago siya magkaroon ng onset of action. Okay, and it is basically prescribed. Alright, we also look on to the side effects, no, of this anticoagulants like the warfarin. It also causes headaches, no, kaning mga medications nato na ay cases na magsakit kay ang ulo. So paracetamol can just be taken by the patient. Alright, so that's your warfarin, heparin, and then the next is the antiplatelet. So antiplatelets, no, it's basically used, no, to prevent platelet aggregation or the clumping together of the clot. No, mao na siya antiplatelet. Okay? So ang usual na naririnig natin na example ng antiplatelet is the aspirin, no? It has a prolonged antiplatelet activity. You also have the Plavix or the clopidogrel, no? Mga silostazole or the Pletail. Okay? So, ang problema lang nitong antiplatelet natin, it can cause GI bleeding. Very common in the hospital na tigulang na-admit kay nagsuka na siya og dugo. Then upon assessment, nakitaan na nagainom di ay siya og aspirin, no? Once a day kasi maintenance dose niya at hindi siya nagakain ng maayos kaya nag-ulceration siya. No, mo na siya peptic ulcer disease secondary to aspirin ingestion. No, mo na siyang mga diagnostic, no, na diagnosis sa mga pasyente. And what is also important with like antiplatelets na to, since it's a maintenance, it is the usual maintenance medication, no, na ginainom ng pasyente. So kung for surgery ang pasyente, antiplatelets must be discontinued 7 days prior to the surgery. No, so that's also a very important responsibility, like nurses, no, pag mangutana ta, ma'am, schedule ka na for surgery next week, unsa man imong mga tambal, no? So pag nakitaan mo doon ng aspirin or Pletal or the Plavix, no, clopidogrel, so dapat i-inform mo na i-stop. Okay, kasi pwedeng mag-bleed ang pasyente doon sa operating table. Then next, medication which affect blood coagulation is the thrombolytic agent. Ito namang thrombolytic agents, no, it's called the clot buster, no, ghost buster, clot buster kasi, no, they have the capacity to convert plasmin or plasminogen to plasmin, no, in order to dissolve the clot. Okay? So, siya ang nagapa-enhance, no, ng capability of the plasmin, no? Madami ang plasmin inside the system, gina-encourage niya na mudaghan ang plasmin para ma-degrade ang fibrin clots. That's the mode of action of thrombolytic agents, no? It is indicated for pulmonary embolism, for deep vein thrombosis, no, kanang mga traveling clots, no, mga na-dislodge na mga clot. You have myocardial infarction, acute ischemic stroke, or cerebrovascular accidents, no, mga thrombolytic stroke. What is important with thrombolytic agents like the streptokinase, the tissue plasminogen activator or the TPAs, no, ug urokinase, mao ni siya ang ginagamit sa San Pedro Hospital. Okay? Time is of an essence. Time is very important, no? Nurses, kinahanglan mangutana, ma'am, kanusa man jud ni siya na walaan og na collapse, no? Ganina man to siya, ma'am, alas 8, pagtan-aw nimo sa time, uy, alas 9 pa. Pwede pa, ma'am, no? So, i-CT scan ang pasyente, but the time is very important kasi ang thrombolytic agent, no, the agent can actually disintegrate the clot within 4 hours after acute myocardial infarction. Okay, 4 hours, no? Kaya pa labanan ni thrombolytic agent. Pwede pang maagapan with streptokinase intravenous infusion. Pwede pang matunaw ang clot. Pero, pag abot sa pasyente, nag-stroke siya og alas 7, naabot sa ER og alas 5, lupay-pay ng pasyente, no? Nag-myocardial ischemia, wala na, na-ICU na ang pasyente, di na matabang. Kay dugay naman kaayo, no? So always remember, pag thrombolytics, no, it's basically 4 hours for myocardial infarction and 3 hours for thrombolytic stroke, kanang cerebrovascular accident. Okay? So mo nang mangutana jud og oras ang mga medical practitioners sa ER, no? Kasi pag sobrang tagal na there would be low chances of winning the race, kumbaga. No? Kay gahi na kaayo, murag sa Bisaya pa wala na, nga pwede na yung kusuga sa klat diha, kay pila na ka oras ang ilabay. Okay, mo nang importante health teachings na to sa community, pag may problema, pag mataas ang BP, asymptomatic pag yun, no? Mo nang lisod, kay walay signs, no? Tapos 200 over 100 na di ay ang BP sa pasyente sa community, bigla lang siya natumba, di ba? Mao na di ay ito, nag-aneurysm na di ay because of the increased resistance, alright? So since the thrombolytic agents would be a blood thinner, potent blood thinner, no, mo nang kinahanglan pud nato og antidote. Okay, so the antidote is the aminocaproic acid or the amicar. Okay, it would readily stop the bleeding by inhibiting plasminogen activation, which inhibits thrombolysis. Okay, so kana siya ang ato ang antidote. And the aminocaproic acid is also a hemostatic agent. So that's the last part, no, sa ato ang blood coagulation medication. Hemostatics, no, kanang ginagamit po na siya during the war, no, because it can gradually lessen the bleeding, no, kanang sa mga napusilan, no, kanang sa gyera nga wala sila emergency diha, no, na hospitals kay layo sila. So they bring along, soldiers would bring along hemostatic agents, no, kanang nakalagay na sa ointment, nakalagay na sa gauze, tapos pag nasugat, yun lang ang ipatong nila, no, sa sugat para mag-stop ang bleeding, no. Mag-stop ang bleeding para dili mag-hypovolemic shock ang pasyente. Okay, so examples for those hemostatic agents, since they hasten clotting of blood by inhibiting the substance that activates plasminogen. Okay, so anti-hemorrhagic agents po ang tawag sa hemostatic agent, no? Promotes hemostasis and it would stop the bleeding. Okay? Ang problema nito is hypertension. Kung kanina sa ato ang blood thinners is hypotension, diri sa hemostatic agent, kabaliktaran siya. You have hypertension. Alright? So, yun din ang titingnan, no? It can actually have hypertensive episodes. Okay? Example na to, ani, aminocaproic acid, vitamin K, no? Yung ating mga antidotes and the tranexamic acid or the hemostan. Some of you were able to have dental extraction and dentists would actually prescribe hemostan, no? To be taken for 3 days or 2 to 3 days para ma-stop lang ang bleeding. Okay, so that's tranexamic acid, hemostan. All right. So that's it, no, for the lessons that I have shared to you, but it's very, very important na mag-listen pa rin kayo doon kasi meron akong hindi na-dimension, no, na andoon talaga sa lecture ko, no. Have your notes, no, while you are listening to that lesson that I have posted over Clipper. Time check, it's 10:26. Let's have a 5-minute tea break, no? Or you might want to drink coffee on the side, then we shall be back for the antiviral. Okay? Balik kayo. Just stay put. All right?